Do you have a shoulder problem? Are you suffering from shoulder pain which is not resolving with rest, medication and physical therapy? Is the MRI showing a rotator cuff tear? If your answer is yes, you may then have to consider surgery.
Hi, I am Dr. Satish Mutha. I am an orthopedic and spine surgeon practicing in Mumbai. My team at Siddhi Clinic strives hard to provide state-of-the-art surgical and non-surgical treatment for the shoulder, hip, knee, spine and even minimally invasive surgery. We also specialize in the treatment of complex fractures, failed fracture surgeries and post-surgical infections. I am here to share with you selective treatment strategies based on individual needs and assure you of exceptional orthopedic care. Thank you.
What is rotator cuff? Rotator cuff. The rotator cuff is a group of 4 muscles that come together as tendons to form a covering around the head of the upper arm bone called humerus. The rotator cuff attaches the humerus to the shoulder blade and helps to lift and rotate your arm. Your arm is kept in your shoulder socket by your rotator cuff. There is a lubricating sac called a bursa between the rotator cuff and the bone on top of your shoulder. The bursa allows the rotator cuff tendons to glide freely when you move your arm. The rotator cuff is made up of 4 muscles: the Supraspinatus, the Infraspinatus, the Subscapularis, and the Teres minor. What is a rotator cuff tear? When one or more of the rotator cuff tendons is torn, the tendon no longer fully attaches to the head of the humerus. Most tears occur in the supraspinatus tendon, but other parts of the rotator cuff may also be involved. In other words, there can be partial rotator cuff tear, or full-thickness rotator cuff tear. Causes: rotator cuff tear usually occur after a shoulder injury which sometimes may be minor in an elderly person. Non-surgical treatment options may include rest, non-steroidal anti-inflammatory medication, strengthening exercises and physical therapy, steroid injections. If other conservative treatments have not helped, then your doctor is likely to recommend surgery. What happens during shoulder arthroscopy? Anesthesia. Arthroscopic surgery is performed under regional or general anesthesia, depending on the patient's medical profile and type of procedure. Incision. The surgeon makes well-positioned skin incisions or portals in your shoulder. Irrigating fluid is then pumped into your shoulder to expand the joint. This makes it easier for the surgeons to see inside the joint. Arthroscopy. The arthroscope is entered into one of the cuts and the surgeon can look around in your shoulder joint. The image produced by the camera is reflected on the monitor in the operating room. The surgeon first locates the problem in your shoulder and makes an arthroscopic diagnosis. Surgical process. The surgeon then inserts small tools inside your shoulder through small portals to correct the issue. Any damaged tissue or bone spurs are removed, or repaired by using an arthroscope. This avoids the need to detach the deltoid muscle. A partial tear may need only a trimming or smoothing procedure called a debridement. Rotator cuff tear is repaired by stitching the tendon back to its original site on the humerus. Sutures are attached to the anchors, which tie the tendon back to the bone. Brace. At the end of the surgery, the incisions are closed and a brace is given. What are the benefits of arthroscopic rotator cuff repair? Benefits of arthroscopic rotator cuff repair: smaller incisions, no cutting of key muscles and tissues, less pain, less blood loss, less risk of infection, shorter hospital stay, faster recovery, less requirement of post-operative physiotherapy. How long is the hospital stay for arthroscopic rotator cuff surgery? Arthroscopic rotator cuff surgery requires 1-day hospital stay. Recovery process. To keep your arm from moving, you will most likely use a sling and avoid using your arm for the first 4 to 6 weeks. A physical therapy program will help you regain shoulder strength and motion. Before-after pictures. You can reach Dr. Satish Mutha at his consulting chamber at City Nursing Home. Dr. Satish Mutha is an orthopedic consultant and orthopedic surgeon trained in Mumbai. He is being routinely performing such surgeries since last 10 years, with consistently good result. Dr. Mutha specializes in the treatment of complex fractures, failed fracture surgeries and post-surgical infections. He has been trained at various centers of repute in USA, UK and France. Currently he holds the following position: Honorary Assistant Professor, Orthopaedics, KB Baba Hospital, Bandra, Mumbai. EC Member, Bombay Orthopaedic Society. EC Member, NAILS. He is a consultant orthopedic surgeon at various hospitals in Mumbai, including Hinduja Healthcare Hospital, Khar, Mumbai; SL Rahija Fortis Hospital, Mahim; Holy Family Hospital, Bandra; Guru Nanak Hospital, Bandra East, Mumbai; BSESMG Hospital, Andheri West, Mumbai; Kriti Care Hospital, Andheri West, Mumbai. To schedule appointments for consultations and surgical procedures, please call 2668-5746 or 2668-5747. Email your queries to mutha@gmail.com or visit www.orthodocforyou.com.